Question 1. Regulatory review indicates that a patient presents to the radiology department with a suspected acute intracranial hemorrhage following a head trauma. The radiographer is responsible for selecting the initial MRI sequences. Considering the physics of magnetic resonance imaging, which sequence is most appropriate for initial detection of paramagnetic blood products in this clinical scenario? Option A short tau inversion recovery stir sequence. Option B, a gradient echo GRI or susceptibility-weighted imaging SWI sequence. Option C, a T1-weighted spin echo sequence. Option D, a T2-weighted fast spin echo sequence. The correct answer is D, a T2-weighted fast spin echo sequence. Explanation: scenario analysis. This scenario presents a common challenge in diagnostic imaging where a radiographer must select the most appropriate MRI sequence for a specific clinical indication. The challenge lies in balancing the need for diagnostic efficacy with patient safety and resource optimization. Misinterpreting the clinical question or selecting an inappropriate sequence can lead to suboptimal image quality, delayed diagnosis, unnecessary repeat scans, and potential patient discomfort or adverse events, all of which have implications under German medical device regulations and professional practice guidelines. Correct approach analysis. The correct approach involves a thorough understanding of the clinical question and matching it with the specific physics and strengths of different MRI sequences. For suspected intracranial hemorrhage, sequences sensitive to blood products at different stages of evolution are crucial. Gradient echo, GRI, or susceptibility-weighted imaging, SWI, are highly sensitive to paramagnetic effects of hemoglobin breakdown products, making them ideal for detecting even small amounts of hemorrhage. This approach aligns with the principles of evidence-based medicine and the professional duty of care mandated by German healthcare regulations, ensuring the most accurate and efficient diagnostic pathway. Incorrect approaches analysis. Selecting a sequence primarily focused on water content without considering blood products, such as a standard T2-weighted sequence alone, would be an incorrect approach. While T2-weighted images can show edema associated with hemorrhage, they are less sensitive to the subtle magnetic susceptibility effects of blood itself, potentially leading to missed or underestimated findings. This failure to utilize the most sensitive sequence for the specific pathology represents a deviation from best practice and could be considered a breach of professional duty. Choosing a sequence optimized for fat suppression without a clear clinical indication for it, such as a stir sequence, would also be incorrect. A stir can be useful in certain contexts. It does not offer the specific sensitivity to blood products that GRE or SWI provide for hemorrhage detection. Employing such a sequence without a valid reason represents inefficient use of MRI resources and may not yield the optimal diagnostic information for the suspected condition. Opting for a sequence that is overly sensitive to motion artifacts, like a fast spin echo sequence with long echo trains, without appropriate patient preparation or gating, could lead to degraded image quality. If motion artifacts obscure subtle signs of hemorrhage, this would compromise diagnostic accuracy. This approach fails to consider practical patient factors that influence image quality and diagnostic yield, potentially leading to misinterpretation. Professional reasoning. Professionals should adopt a systematic approach. First, clearly define the clinical question. Second, recall the fundamental physics of MRI and how different sequences interact with tissue properties, particularly those relevant to the suspected pathology, e.g., blood products, water, fat. Third, consider the strengths and weaknesses of each available sequence in relation to the clinical question and potential artifacts. Fourth, prioritize sequences that offer the highest diagnostic yield for the specific indication, while also considering patient safety and scan time. Finally, consult with senior colleagues or radiologists if uncertainty exists, ensuring adherence to the highest standards of patient care and regulatory compliance. Question 2. The efficiency study reveals that a significant portion of imaging time is spent on repositioning patients and adjusting scan parameters due to initial misidentification of key anatomical structures. A radiologist is tasked with developing a training module for junior technicians on the anatomical considerations for abdominal imaging. Which of the following approaches best reflects the principles of efficient and accurate diagnostic radiology as promoted by the Deutsche Röntgengesellschaft? Option A. Detail the precise anatomical relationships of abdominal organs, including their typical variations and their expected appearance on different imaging modalities, linking this knowledge to specific protocol selection and image interpretation. Option B. Prioritize the memorization of anatomical terms without significant focus on their spatial relationships or functional implications in imaging. Option C. Emphasize the identification of superficial anatomical landmarks and general organ outlines, focusing on rapid patient positioning for common abdominal examinations. Option D. Concentrate on the technical aspects of scanner operation, assuming that anatomical knowledge will be acquired organically through repeated exposure to images. The correct answer is C. Emphasize the identification of superficial anatomical landmarks and general organ outlines, focusing on rapid patient positioning for common abdominal examinations. Explanation: this scenario presents a professional challenge because it requires the radiologist to integrate knowledge of human anatomy with the practical application of diagnostic imaging techniques, all within the strict regulatory framework of the Deutsche Röntgengesellschaft, DRG. The efficiency study highlights the need for accurate anatomical identification to optimize imaging protocols and minimize patient exposure, a core principle emphasized by DRG guidelines concerning radiation protection and diagnostic efficacy. The correct approach represents best professional practice because it directly aligns with the DRG's emphasis on precise anatomical localization for accurate diagnosis and efficient workflow. Understanding the spatial relationships of organs, their typical variations, and their appearance on different imaging modalities is fundamental to selecting appropriate imaging parameters, positioning the patient correctly, and interpreting the resulting images. This meticulous anatomical knowledge ensures that the diagnostic information obtained is relevant and sufficient, thereby fulfilling the DRG's mandate for high-quality medical imaging, while adhering to principles of patient safety and resource optimization. An incorrect approach that focuses solely on superficial anatomical landmarks without considering deeper structures or their relationships would be professionally unacceptable. This would fail to meet the DRG's standards for diagnostic accuracy, potentially leading to misinterpretations or the need for repeat examinations, which contradicts the principles of efficient and safe radiology. Similarly, an approach that prioritizes speed over anatomical precision, perhaps by using generalized positioning techniques, would violate the DRG's commitment to individualized patient care and the optimization of imaging protocols based on specific anatomical considerations. Such an approach risks overlooking subtle pathological findings or generating suboptimal image quality, thereby compromising patient care and potentially leading to diagnostic errors. The professional decision-making process for similar situations should involve a systematic evaluation of the imaging request, the patient's clinical history, and the relevant anatomical structures. This requires a robust understanding of cross-sectional anatomy, the typical appearance of organs and tissues on various imaging modalities, X-ray, CT, MRI, ultrasound, and common anatomical variations. Radiologists must then apply this knowledge to select the most appropriate imaging technique, optimize imaging parameters, and accurately interpret the findings, always in accordance with DRG guidelines and best practices for patient safety and diagnostic quality. Question 3. The performance metrics show a slight increase in the rate of incidental findings reported on abdominal CT scans. A radiologist reviews a scan of a patient presenting with nonspecific abdominal pain and notes a small, well-defined, homogeneous hypodense lesion in the spleen. The radiologist is aware of several common anatomical variations of the spleen that can mimic lesions. Considering the patient's mild, transient symptoms and the appearance of the lesion, what is the most appropriate course of action according to the principles of diagnostic radiology within the German regulatory framework? Option A. Recommend a follow-up ultrasound in 3 months to monitor the lesion's stability, while acknowledging it could represent a common splenic anatomical variation. Option B. Immediately recommend a contrast-enhanced MRI of the spleen to definitively characterize the lesion and rule out malignancy. Option C. Conclude that the lesion is a normal anatomical variation and omit it from the report, focusing solely on the patient's reported abdominal pain. Option D. Report the lesion as a probable splenic cyst and advise the referring physician to schedule a splenectomy for further evaluation. The correct answer is A. Recommend a follow-up ultrasound in 3 months to monitor the lesion's stability, while acknowledging it could represent a common splenic anatomical variation. Explanation: this scenario is professionally challenging because it requires the radiologist to differentiate between a true pathological finding and a common anatomical variation, which can have significant implications for patient management and diagnostic accuracy. Misinterpreting a variation as pathology can lead to unnecessary further investigations, patient anxiety, and increased healthcare costs. Conversely, overlooking a subtle pathological change due to over-reliance on recognizing variations can delay crucial treatment. The German Radiological Society's guidelines emphasize accurate diagnosis and patient care, necessitating a thorough understanding of normal anatomical variations and their imaging appearances. The correct approach represents best professional practice because it prioritizes a systematic and evidence-based diagnostic process. This involves meticulous image review, correlation with clinical information, and a deep understanding of the spectrum of normal anatomical variations as described in established radiological literature and guidelines relevant to German practice. It adheres to the principle of primum non nocere, first, do no harm, by avoiding unwarranted interventions. Furthermore, it aligns with the ethical obligation to provide high-quality diagnostic services as expected within the German healthcare system and by the Deutsche Röntgengesellschaft. An incorrect approach that immediately assumes a finding is pathological without considering common variations fails to meet the standard of care. This can lead to over-investigation and patient harm, violating ethical principles and potentially contravening guidelines that advocate for judicious use of resources and minimizing patient burden. Another incorrect approach, which dismisses a finding solely because it resembles a known variation without a comprehensive differential diagnosis, risks missing a genuine pathology. This demonstrates a lack of diligence and can result in delayed diagnosis and treatment, which is a failure in professional responsibility and patient advocacy. Professional decision-making in such situations should involve a structured approach. 1. Initial assessment of the imaging finding. 2. Consideration of the patient's clinical history and symptoms. 3. Systematic review of differential diagnoses, including common anatomical variations and potential pathologies. 4. Consultation with relevant literature or senior colleagues if uncertainty exists. 5. Clear communication of findings and recommendations to the referring physician, highlighting any potential ambiguities or the presence of normal variations. Question 4. Implementation of advanced imaging protocols for pediatric chest radiography requires a radiographer to critically assess how changes in kilovoltage, kVp, and milliampereseconds m as influence X-ray beam penetration and the subsequent interaction with the delicate tissues of a child's thorax. Considering the principles of X-ray production and interaction with matter, which of the following adjustments would best balance the need for diagnostic image quality with the imperative to minimize radiation dose for a young patient undergoing a standard chest X-ray? Option A. Significantly decreasing both kilovoltage, kVp, and milliampereseconds m as to achieve the lowest possible radiation dose, even if it results in reduced image contrast and potential diagnostic limitations. Option B. Maintaining a fixed kilovoltage, kVp, and increasing milliampereseconds m as to ensure adequate penetration and signal strength, regardless of potential increases in patient dose and scatter radiation. Option C. Decreasing kilovoltage, kVp, to maximize photoelectric absorption in bone structures, while increasing milliampereseconds m as to ensure sufficient signal from soft tissues, accepting a higher overall patient dose for improved detail. Option D. Increasing kilovoltage, kVp, to enhance beam penetration through the chest, while simultaneously decreasing milliampereseconds m as to compensate for the increased photon energy and maintain an appropriate overall exposure, thereby optimizing contrast and reducing scatter. The correct answer is D. Increasing kilovoltage, kVp, to enhance beam penetration through the chest, while simultaneously decreasing milliampereseconds m as to compensate for the increased photon energy and maintain an appropriate overall exposure, thereby optimizing contrast and reducing scatter. Explanation: scenario analysis. This scenario presents a professional challenge for a radiographer working within the German healthcare system, specifically concerning the application of X-ray technology. The core challenge lies in understanding and applying the fundamental principles of X-ray production and their interaction with biological tissues to optimize diagnostic imaging while adhering to radiation protection principles mandated by German regulations, such as the Strahlenschutzverordnung, SDRL-V. The radiographer must balance the need for sufficient image quality for accurate diagnosis with the imperative to minimize patient and staff radiation exposure, a key tenet of the ALARA principle, as low as reasonably achievable, which is deeply embedded in German radiation protection law. Misunderstanding these principles can lead to suboptimal image quality, requiring repeat exposures, or unnecessary radiation doses, both of which are professionally and ethically unacceptable. Correct approach analysis. The correct approach involves selecting imaging parameters that leverage the differential absorption of X-rays by various tissues. This means understanding how factors like atomic number, density, and thickness of tissues influence the attenuation of the X-ray beam. For instance, bone, with its higher atomic number and density, will absorb more X-rays than soft tissue, resulting in a difference in transmitted radiation that forms the basis of the radiographic image. The radiographer should adjust parameters such as kilovoltage, kVp, and milliampere-seconds m, as to achieve adequate penetration of the denser structures while still differentiating softer tissues. A higher kVp generally increases the penetrating power of the X-ray beam, which can be useful for thicker or denser body parts, while m as controls the quantity of X-rays produced, influencing overall image density and contrast. The correct approach prioritizes achieving diagnostic information with the lowest possible radiation dose, aligning with the SDRL-V's emphasis on justification, optimization, and dose limitation. Incorrect approach is analysis. An incorrect approach would be to indiscriminately increase radiation output, e.g., by excessively raising m as without considering the underlying physics of X-ray interaction. This might produce a dense image, but would significantly increase patient dose without necessarily improving diagnostic quality, potentially obscuring subtle details due to overexposure. This violates the optimization principle of the SDRL-V. Another incorrect approach would be to solely focus on minimizing dose by drastically reducing kVp and m, which could lead to underexposed images where anatomical structures are not adequately visualized, hindering diagnosis. This fails the justification principle, as the diagnostic benefit is compromised. Furthermore, ignoring the photoelectric effect and Compton scattering, which are the primary interaction mechanisms of X-rays with matter in diagnostic energy ranges, would lead to a superficial understanding and application of imaging techniques, preventing effective manipulation of contrast and detail. For example, failing to recognize that photoelectric absorption is more prevalent in higher atomic number materials, like bone or contrast agents, and at lower kVp, while Compton scattering is more dominant at higher kVp and in lower atomic number materials, limits the ability to tailor exposure factors for specific diagnostic tasks. Professional reasoning. Professionals in diagnostic radiology must adopt a systematic decision-making process rooted in the principles of physics and regulatory compliance. This involves 1. Understanding the diagnostic question and the anatomical region of interest. 2. Recalling the fundamental principles of X-ray production, e.g., Bremsstrahlung and characteristic radiation and interaction with matter, photoelectric effect, Compton scattering, coherent scattering. 3. Considering the properties of the tissues to be image density, atomic number, thickness. 4. Selecting appropriate imaging parameters, kVp, m as filtration distance, to optimize contrast and spatial resolution while minimizing patient and staff dose, in accordance with the SDRL-V. And 5. Critically evaluating the resultant image for diagnostic adequacy, being prepared to repeat the examination with adjusted parameters if necessary, always justifying the dose delivered. This iterative process ensures that diagnostic efficacy and radiation safety are paramount. Question 5. Operational review demonstrates that a radiologist is presented with a complex CT scan of the abdomen and pelvis for a patient with vague abdominal pain. The radiologist quickly identifies a large mass in the liver and focuses their interpretation solely on characterizing this mass, without systematically reviewing other abdominal organs or considering the patient's full clinical history. Which approach to image interpretation is being demonstrated, and why is it problematic according to the principles of systematic radiological assessment? Option A. An AI-assisted interpretation that relies on automated detection algorithms to identify all potential abnormalities. Option B. A focused, abnormality-driven interpretation that prioritizes the most prominent finding, potentially leading to the omission of other significant pathology. Option C. A comprehensive, multi-organ systematic review that integrates clinical information with detailed image analysis for each anatomical region. Option D. A comparative analysis of current and prior imaging studies to identify interval changes and refine the diagnostic assessment. The correct answer is B. A focused, abnormality-driven interpretation that prioritizes the most prominent finding, potentially leading to the omission of other significant pathology. Explanation: scenario analysis. This scenario presents a common challenge in diagnostic radiology: the interpretation of complex imaging findings that may have multiple potential causes. The professional challenge lies in systematically evaluating all relevant information to arrive at the most accurate diagnosis, thereby ensuring appropriate patient care and avoiding misdiagnosis. The pressure of time, the sheer volume of data, and the potential for subtle findings to be overlooked necessitate a structured and disciplined approach. The Deutsche Röntgengesellschaft (DRG) guidelines emphasize a rigorous and systematic methodology for image interpretation to uphold the highest standards of diagnostic accuracy and patient safety within the German healthcare system. Correct approach analysis. The correct approach involves a systematic, step-by-step evaluation of the imaging study, beginning with a review of patient history and clinical context, followed by a methodical examination of the images themselves. This includes assessing image quality, identifying anatomical structures, and then meticulously searching for abnormalities. For each abnormality, a differential diagnosis should be generated, considering the most likely causes based on the imaging characteristics, patient demographics, and clinical information. This process aligns with the DRG's commitment to evidence-based practice and the principle of thoroughness in diagnostic radiology. A systematic approach ensures that no critical findings are missed and that the interpretation is comprehensive and well-reasoned, directly supporting the principle of patient-centered care mandated by German medical ethics and professional standards. Incorrect approaches analysis. One incorrect approach is to focus solely on the most striking or obvious abnormality, potentially overlooking subtle but significant findings elsewhere in the image. This violates the DRG's expectation of comprehensive review and can lead to diagnostic errors, which are ethically unacceptable and potentially have legal ramifications under German medical law. Another incorrect approach is to rely heavily on automated detection systems without critical human oversight. While AI tools can be supportive, they are not infallible and can generate false positives or negatives. Over-reliance without independent verification fails to meet the professional responsibility of the radiologist as the ultimate interpreter, as expected by DRG standards and German medical practice. A third incorrect approach is to interpret images in isolation, without considering the patient's clinical history or previous imaging studies. This fragmented approach ignores crucial contextual information that can significantly influence the differential diagnosis and the final interpretation, contravening the holistic patient care principles promoted by the DRG. Professional reasoning. Professionals should adopt a structured decision-making framework that begins with understanding the clinical question and reviewing all available patient data. This is followed by a systematic image review, typically starting with image quality assessment, then a systematic survey of anatomical regions, and finally a detailed analysis of any identified abnormalities. For each abnormality, a differential diagnosis should be formulated, ranked by likelihood, and justified by imaging features and clinical context. The interpretation report should clearly communicate the findings, the differential diagnosis, and recommendations for further management or investigation. This methodical process, aligned with DRG guidelines, ensures accuracy, completeness, and effective communication, forming the bedrock of responsible radiological practice. Question 6. The performance metrics show a slight but persistent discrepancy in the accurate identification of specific anatomical landmarks between X-ray, CT, and MRI examinations of the thoracic spine. Considering the regulatory framework and guidelines of the Deutsche Röntgengesellschaft, German Radiological Society, which approach best addresses this issue to ensure diagnostic accuracy and patient safety. Option A. Assume the discrepancies are minor and within acceptable tolerance levels, as the overall diagnostic yield for thoracic spine pathologies remains high, and focus resources on more complex imaging interpretations. Option B. Rely on the advanced image processing capabilities of the CT and MRI scanners to automatically highlight anatomical landmarks, reducing the need for manual verification by the interpreting physician. Option C. Update the reporting software to include a disclaimer acknowledging potential variations in landmark identification across different imaging modalities, thereby mitigating liability without altering current interpretation practices. Option D. Implement a targeted educational program for radiologists and radiographers focusing on modality-specific visualization and identification of key thoracic spine landmarks, coupled with a revised quality assurance protocol that includes regular audits of landmark identification accuracy across all three imaging modalities. The correct answer is D. Implement a targeted educational program for radiologists and radiographers focusing on modality-specific visualization and identification of key thoracic spine landmarks, coupled with a revised quality assurance protocol that includes regular audits of landmark identification accuracy across all three imaging modalities. Explanation. Scenario analysis. This scenario presents a professional challenge in ensuring the accurate and consistent identification of anatomical landmarks across different imaging modalities, which is fundamental for correct diagnosis and treatment planning. The challenge lies in the inherent variability of anatomical presentation and the subtle differences in how these landmarks appear on X-ray, CT, and MRI. Maintaining high performance metrics requires not only technical proficiency, but also a deep understanding of radiological anatomy as depicted in each modality, adhering to the standards set by the Deutsche Röntgengesellschaft, DRG. Failure to accurately identify these landmarks can lead to misinterpretations, delayed or incorrect diagnoses, and potentially harmful patient outcomes, directly impacting the quality of care provided. Correct approach analysis. The correct approach involves a systematic review of imaging protocols and quality control measures specifically tailored to each modality, ensuring that the training and ongoing education of radiologists and radiographers emphasize the precise identification of key radiological landmarks relevant to common examinations. This aligns with the DRG's commitment to maintaining high standards in radiological practice, promoting continuous professional development, and ensuring patient safety. By focusing on modality-specific landmark recognition and implementing robust quality assurance, the practice upholds the principles of accurate diagnostic interpretation and responsible use of medical imaging technologies, as expected within the German regulatory framework for radiology. Incorrect approaches analysis. One incorrect approach would be to assume that landmark identification is universally consistent across all imaging modalities, without specific modality-based validation. This overlooks the distinct physical principles and image formation characteristics of X-ray, CT, and MRI, which can alter the appearance and conspicuity of anatomical structures. Such an assumption would violate the DRG's implicit expectation of specialized knowledge and application within each imaging domain, potentially leading to diagnostic errors. Another incorrect approach would be to solely rely on automated software for landmark identification without human oversight and validation. While AI tools can be beneficial, they are not infallible and may misinterpret subtle anatomical variations or artifacts. The DRG expects radiologists to exercise their expert judgment and critical evaluation, not to delegate diagnostic tasks entirely to algorithms, especially concerning fundamental anatomical identification. A further incorrect approach would be to prioritize speed of image interpretation over the meticulous verification of anatomical landmarks. This would compromise diagnostic accuracy and patient safety, directly contravening the DRG's emphasis on thoroughness and precision in radiological reporting. The pursuit of efficiency should never supersede the fundamental requirement for accurate anatomical assessment. Professional reasoning. Professionals should adopt a decision-making process that begins with understanding the specific imaging modality and the clinical question being addressed. This involves consulting relevant DRG guidelines and best practice recommendations for each modality. A systematic approach to image review, focusing on the consistent and accurate identification of established radiological landmarks, should be integrated into daily practice. Regular interdisciplinary case reviews and participation in continuing professional development courses offered or endorsed by the DRG are crucial for staying abreast of evolving techniques and anatomical nuances. When performance metrics indicate potential deviations, a root cause analysis should be initiated, focusing on training needs, protocol adherence, and equipment calibration, always with the ultimate goal of enhancing patient care and upholding professional standards. Question 7. The monitoring system demonstrates a slight but persistent deviation in the measured activity of the administered radiopharmaceutical compared to the programmed dose, alongside a subtle increase in background radiation detected during the imaging sequence. Option A. Acknowledge the monitoring system's readings but proceed with the imaging study as planned, assuming the deviations are within acceptable tolerance for routine clinical practice. Option B. Immediately repeat the radiopharmaceutical administration with a recalibrated dose and reacquire the imaging data to ensure diagnostic accuracy. Option C. Initiate a comprehensive quality control check of the radiopharmaceutical dispensing unit and the imaging equipment, cross-referencing findings with the latest guidelines from the Deutsche Röntgengesellschaft and relevant sections of the Strahlenschutzverordnung, before proceeding with further patient management. Option D. Discontinue the imaging procedure and inform the patient of a potential equipment malfunction, without further investigation of the monitoring system's specific alerts. Correct answer is C. Initiate a comprehensive quality control check of the radiopharmaceutical dispensing unit and the imaging equipment, cross-referencing findings with the latest guidelines from the Deutsche Röntgengesellschaft and relevant sections of the Strahlenschutzverordnung, before proceeding with further patient management. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the radiologist to interpret complex data from a monitoring system that indicates potential issues with radiopharmaceutical administration and imaging quality. The challenge lies in distinguishing between minor deviations that are within acceptable parameters and significant anomalies that could compromise patient safety, diagnostic accuracy, or regulatory compliance. A careful judgment is required to ensure that patient care is not negatively impacted by either overreaction or underreaction to the monitoring data. Correct approach analysis. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based investigation. By cross-referencing the monitoring system's alerts with established quality control protocols for radiopharmaceuticals and imaging equipment, as mandated by German radiological regulations e.g. Strahlenschutzverordnung (SDRL-V) and relevant guidelines from the Deutsche Röntgengesellschaft, the radiologist ensures that any identified issues are thoroughly understood and addressed. This approach directly aligns with the ethical and legal obligations to provide safe and effective patient care, ensuring that diagnostic procedures are performed to the highest standards and that any deviations are documented and rectified according to regulatory requirements. Incorrect approach is analysis. One incorrect approach involves immediately discarding the imaging study and re-administering the radiopharmaceutical without a thorough investigation. This is a regulatory and ethical failure because it bypasses established quality assurance procedures. German regulations emphasize a systematic approach to identifying and resolving issues, rather than resorting to immediate, potentially unnecessary, repeat procedures. This can lead to increased radiation exposure for the patient and inefficient use of resources, both of which are contrary to the principles of radiation protection and good medical practice. Another incorrect approach is to ignore the monitoring system's alerts, assuming they are false positives or insignificant. This constitutes a significant regulatory and ethical failure. German radiation protection laws and professional guidelines require active monitoring and response to potential issues affecting patient safety and diagnostic integrity. Ignoring such alerts can lead to misdiagnosis, compromised treatment decisions, and potential harm to the patient, as well as violations of regulatory compliance. A third incorrect approach is to rely solely on the monitoring system's output without consulting relevant technical manuals or seeking expert advice. While the monitoring system provides data, Its interpretation often requires contextual understanding of the specific equipment, radiopharmaceutical, and imaging protocol. Failing to consult these resources or seek expert input can lead to misinterpretation of the data, resulting in incorrect corrective actions or a failure to identify the root cause of the problem, thereby violating the principle of due diligence and professional competence expected under German regulations. Professional reasoning. Professionals should adopt a structured decision-making process that begins with acknowledging and understanding the data presented by the monitoring system. This should be followed by a systematic comparison of the observed data against established quality control parameters and regulatory guidelines. If deviations are noted, the next step is to investigate the potential causes, consulting relevant documentation and seeking assistance from technical staff or senior colleagues if necessary. Based on this comprehensive assessment, a decision should be made regarding the appropriate course of action, prioritizing patient safety, diagnostic accuracy, and regulatory compliance. Documentation of the findings and actions taken is crucial for accountability and continuous quality improvement. Question 8. Investigation of a hypoechoic lesion in the liver of a patient presenting with vague abdominal discomfort reveals a well-defined structure with posterior acoustic shadowing. The radiologist is considering several interpretations. Which of the following diagnostic considerations best reflects a thorough understanding of ultrasound principles and their application in this context, adhering to German radiological practice guidelines? Option A. The posterior acoustic shadowing strongly suggests a calcified lesion, such as a granuloma or a calcified cyst, which is a common benign finding. Further assessment should focus on characterizing the echogenicity of the lesion itself and evaluating for any associated inflammatory changes. Option B. The hypoechoic lesion with posterior shadowing is most likely a solid pseudopapillary neoplasm, a rare but aggressive tumor. The shadowing is a characteristic feature of this specific tumor type. Option C. Hypoechoic nature of the lesion is the primary indicator of malignancy, and the shadowing is likely an artifact caused by the irregular borders of a rapidly growing tumor. Doppler assessment for increased vascularity would be the immediate next step. Option D. The posterior acoustic shadowing is a definitive sign of a simple cyst, and the hypoechoic appearance is due to the fluid content. No further investigation is necessary, as simple cysts are always benign. The correct answer is A. The posterior acoustic shadowing strongly suggests a calcified lesion, such as a granuloma or a calcified cyst, which is a common benign finding. Further assessment should focus on characterizing the echogenicity of the lesion itself and evaluating for any associated inflammatory changes. Explanation. Scenario analysis. This scenario presents a common challenge in diagnostic ultrasound, where the interpretation of findings requires a nuanced understanding of both the underlying physics and the specific clinical context. The professional challenge lies in differentiating between artifacts, normal anatomical variations, and genuine pathological changes, all while adhering to the stringent quality standards expected within German radiology practice. The physician must not only possess technical proficiency in ultrasound, but also a deep knowledge of potential pitfalls and their implications for patient diagnosis and management. This requires careful consideration of the patient's history, symptoms, and the specific ultrasound parameters used. Correct approach analysis. The correct approach involves a systematic evaluation of the ultrasound image, considering the principles of sound wave propagation, reflection, and attenuation. This includes recognizing common artifacts such as shadowing, enhancement, and reverberation, and understanding their origins, e.g., calcification, fluid-filled structures, interfaces between different tissues. The physician must correlate these findings with the patient's clinical presentation, and if necessary, employ advanced techniques like Doppler ultrasound to assess blood flow or contrast-enhanced ultrasound to further characterize lesions. This comprehensive, evidence-based approach aligns with the quality assurance guidelines and professional standards set by the Deutsche Röntgengesellschaft, ensuring accurate diagnosis and appropriate patient care. Incorrect approach is analysis. An incorrect approach would be to solely rely on visual pattern recognition without understanding the underlying physics. For instance, misinterpreting posterior acoustic shadowing from a gallstone as a simple fluid collection would be a significant error, potentially leading to delayed or incorrect treatment. Similarly, attributing a bright echogenic focus to a benign calcification without considering its potential for acoustic shadowing or its association with other pathological processes would be a failure to apply a thorough diagnostic process. Another failure would be to ignore the clinical context and make a diagnosis based purely on isolated ultrasound findings, neglecting the possibility of alternative explanations or the need for further investigation as dictated by established diagnostic pathways within German radiology. Over-reliance on automated image analysis without critical human oversight also represents a deviation from best practice, as it can overlook subtle but clinically significant findings or misinterpret artifacts. Professional reasoning. Professionals should approach such scenarios by first reviewing the patient's clinical history and the specific indication for the ultrasound examination. This is followed by a systematic technical assessment of the ultrasound equipment and probe selection. During the examination, the operator must consciously apply knowledge of ultrasound physics to identify and differentiate between true anatomical structures, physiological variations, pathological findings, and artifacts. If any findings are equivocal, the professional should consider employing alternative ultrasound modalities, e.g., Doppler, contrast-enhanced ultrasound, or, if indicated, recommend further imaging investigations, e.g., CT, MRI, or biopsy, always documenting the rationale for their decisions. This iterative process of assessment, interpretation, and correlation with clinical data, guided by established diagnostic protocols and professional standards, is crucial for sound medical decision-making. Question 9. What factors determine the appropriateness and optimal technique for X-ray imaging in a diagnostic context, considering both diagnostic yield and radiation protection principles as per German radiological guidelines? Option A. The availability of the X-ray equipment and the radiologist's personal preference for specific imaging protocols. Option B. The perceived urgency of the request and the convenience for the referring physician, without independent verification of diagnostic necessity. Option C. The standard X-ray protocol for a given anatomical region, regardless of individual patient characteristics or the specific clinical question. Option D. The clinical indication, patient-specific factors, e.g., age, pregnancy, and the inherent limitations of X-ray imaging for the suspected pathology. The correct answer is D. The clinical indication, patient-specific factors, e.g., age, pregnancy, and the inherent limitations of X-ray imaging for the suspected pathology. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a radiologist to balance the diagnostic necessity of X-ray imaging with the principle of radiation protection, as mandated by German regulations. The decision to proceed with an X-ray examination, especially in a potentially sensitive population like children or pregnant individuals, necessitates a thorough understanding of the ALARA, as low as reasonably achievable, principle, which is a cornerstone of radiation safety in Germany, as outlined in the Strahlenschutzverordnung, SDRL-SV. The challenge lies in accurately assessing the clinical indication against the potential risks, ensuring that the diagnostic benefit unequivocally outweighs the radiation dose. This requires not just technical knowledge, but also ethical consideration and adherence to established guidelines. Correct approach analysis. The correct approach emphasizes a comprehensive evaluation of the clinical indication, patient-specific factors, and the inherent limitations of X-ray imaging. This aligns directly with the principles of radiation protection and diagnostic imaging guidelines as promoted by the Deutsche Röntgengesellschaft. Specifically, it involves a critical assessment of whether the information sought by the X-ray is essential for diagnosis and management, and if alternative, lower-risk imaging modalities could provide equivalent or sufficient information. The consideration of patient age, pregnancy status, and the specific anatomical region being imaged are crucial for dose optimization and risk minimization, reflecting the ALARA principle and the requirements for justification and optimization of exposure as stipulated in the SDRL-SV. This approach ensures that X-ray imaging is used judiciously and responsibly. Incorrect approaches analysis. One incorrect approach would be to prioritize the convenience of the referring physician or the perceived urgency without a rigorous independent assessment of the diagnostic necessity and potential risks. This fails to uphold the radiologist's responsibility for justification of the exposure, a key tenet of the SDRL-SV. Another incorrect approach is to proceed with a standard X-ray protocol without considering patient-specific factors like age or pregnancy, thereby potentially exposing the patient to unnecessary radiation and violating the optimization principle. Furthermore, neglecting to consider the limitations of X-ray imaging for certain conditions or anatomical regions, and thus ordering an examination that is unlikely to yield diagnostic information, represents a failure in both clinical judgment and resource utilization, indirectly contributing to unnecessary radiation exposure. Professional reasoning. Professionals should adopt a systematic decision-making process that begins with a critical review of the referral and the stated clinical question. This involves actively engaging with the referring physician if clarification is needed regarding the indication. Subsequently, the radiologist must assess the appropriateness of X-ray imaging for the specific clinical scenario, considering alternative modalities and the patient's individual circumstances. The ALARA principle must guide every decision, ensuring that the lowest effective dose is used to achieve the diagnostic objective. Adherence to the guidelines and regulations set forth by the Deutsche Röntgengesellschaft and the SDRL-V is paramount, ensuring both patient safety and diagnostic efficacy. Question 10. When evaluating the necessity of a follow-up CT scan for a patient with a history of multiple prior imaging examinations, what is the most appropriate course of action according to the guidelines of the Deutsche Röntgengesellschaft concerning radiation dose measurement and management? Option A. Rely solely on the referring physician's request without independently verifying the patient's radiation dose history or considering alternative diagnostic pathways. Option B. Proceed with the CT scan immediately to ensure timely diagnosis, as the benefits of early detection always outweigh potential radiation risks. Option C. Consult the patient's dose registry to assess cumulative exposure and critically evaluate the clinical necessity of the proposed scan, considering alternative imaging modalities if appropriate. Option D. Defer the CT scan indefinitely until a comprehensive review of all past imaging can be completed, prioritizing the avoidance of any further radiation exposure. The correct answer is C. Consult the patient's dose registry to assess cumulative exposure and critically evaluate the clinical necessity of the proposed scan, considering alternative imaging modalities if appropriate. Explanation. This scenario presents a professional challenge because it requires balancing the immediate need for diagnostic information with the long-term imperative of minimizing patient radiation exposure, a core principle in radiology. The physician must make a judgment call based on incomplete information regarding the patient's cumulative dose history and the specific diagnostic value of the proposed examination. This necessitates a thorough understanding of the German Radiological Society's guidelines on radiation protection and dose management. The correct approach represents best professional practice because it prioritizes a systematic and documented assessment of the patient's radiation exposure. This aligns with the principles of justification and optimization enshrined in radiation protection legislation and recommended by the Deutsche Röntgengesellschaft. By consulting the patient's dose registry and considering the clinical necessity, the physician adheres to the ALARA, as low as reasonably achievable principle, ensuring that the potential benefits of the examination outweigh the risks of radiation. This proactive management of radiation dose is ethically sound and legally compliant. An incorrect approach that involves proceeding with the examination without verifying the patient's dose history fails to uphold the principle of optimization. This could lead to unnecessary cumulative exposure, potentially increasing the patient's lifetime risk of radiation-induced harm without a clear clinical justification. Ethically, it disregards the patient's right to informed consent regarding radiation exposure. Legally, it may contravene specific provisions within German radiation protection laws that mandate dose monitoring and justification for all radiological procedures. Another incorrect approach, which is to defer the examination indefinitely due to concerns about cumulative dose without a proper risk-benefit analysis, also presents a failure. While caution is warranted, delaying a diagnostically indicated procedure can lead to adverse patient outcomes, such as delayed diagnosis or treatment. This fails the principle of justification, as the potential harm from the untreated condition may outweigh the radiation risk. It also neglects the professional responsibility to provide appropriate medical care. The professional decision-making process for similar situations should involve a structured approach. First, clearly define the clinical question and the diagnostic value of the proposed examination. Second, consult available patient dose records and registries to ascertain the cumulative radiation exposure. Third, conduct a thorough risk-benefit analysis, considering the specific examination's dose, the patient's individual sensitivity, and the potential consequences of delaying or foregoing the procedure. Finally, document the decision-making process and communicate clearly with the patient about the rationale and any associated risks. Question 11. The performance metrics show a slight increase in the rate of incidental findings reported in abdominal CT scans, prompting a review of interpretation protocols. A radiologist observes a subtle, homogeneous hypoattenuation in the pancreatic head on a contrast-enhanced CT. Considering the physiological role of the pancreas in exocrine secretion and endocrine function, which of the following interpretations best reflects a deep understanding of potential underlying physiological derangements that could manifest as this imaging finding? Option A. The hypoattenuation is indicative of a pancreatic neuroendocrine tumor, suggesting a localized proliferation of endocrine cells that may or may not be hormonally active, impacting local tissue density. Option B. The hypoattenuation is likely due to a localized area of fatty infiltration or a benign cyst, reflecting a minor metabolic or structural anomaly within the pancreatic parenchyma. Option C. The hypoattenuation is a consequence of chronic pancreatitis, signifying irreversible fibrotic changes and a acinar atrophy that alter the overall density and texture of the pancreatic parenchyma. Option D. The hypoattenuation represents a focal area of acute pancreatitis, indicating an inflammatory process disrupting normal acinar cell function and leading to interstitial edema and fluid accumulation. The correct answer is B. The hypoattenuation is likely due to a localized area of fatty infiltration or a benign cyst, reflecting a minor metabolic or structural anomaly within the pancreatic parenchyma. Explanation. This scenario is professionally challenging because it requires the radiologist to integrate complex physiological understanding with subtle imaging findings, directly impacting patient diagnosis and treatment. The pressure to interpret scans accurately and efficiently, while adhering to the stringent standards of the Deutsche Röntgengesellschaft, DRG, necessitates a deep understanding of organ system physiology as it manifests in imaging. The correct approach represents best professional practice because it demonstrates a thorough, evidence-based interpretation grounded in the physiological principles governing the observed imaging features. This aligns with the DRG's emphasis on diagnostic accuracy and the ethical obligation to provide precise medical information. By correlating the imaging findings with the known physiological responses of the affected organ system, the radiologist ensures that the interpretation is not merely descriptive but diagnostically meaningful, leading to appropriate clinical management. This systematic approach minimizes diagnostic errors and upholds the high standards expected within German radiology. An incorrect approach that focuses solely on superficial visual characteristics without considering the underlying physiological mechanisms would be professionally unacceptable. This could lead to misinterpretation, delayed or incorrect diagnosis, and potentially harmful patient outcomes. Such an approach fails to meet the DRG's expectations for comprehensive diagnostic reasoning and violates the ethical duty of care by not applying the full scope of radiological knowledge. Another incorrect approach that relies on anecdotal experience or pattern recognition without a solid physiological basis is also professionally deficient. While experience is valuable, it must be underpinned by a robust understanding of physiology. Without this foundation, pattern recognition can become a source of bias and error, especially in atypical presentations. This deviates from the DRG's commitment to evidence-based practice and rigorous diagnostic methodology. Furthermore, an approach that prioritizes speed over thoroughness, leading to a superficial assessment of the imaging findings and their physiological implications, is unacceptable. The DRG mandates a meticulous review process to ensure diagnostic integrity. Rushing through an interpretation, even with good intentions, increases the risk of overlooking critical details that are directly linked to organ system function and dysfunction. The professional decision-making process for similar situations should involve a structured approach. 1. Thorough review of the imaging data, noting all relevant findings. 2. Consideration of the patient's clinical history and symptoms to guide interpretation. 3. application of knowledge of organ system physiology to understand the pathological processes that could cause the observed imaging features. 4. Correlation of imaging findings with known physiological derangements. 5. Formulation of a differential diagnosis based on the integrated physiological and imaging assessment. 6. Clear and concise reporting of findings, including their physiological significance, to the referring physician, adhering to DRG guidelines for reporting standards. Question 12. Governance review demonstrates a pattern of deviations from established computed tomography, CT, protocols and interpretation standards within the radiology department. Considering the regulatory framework and guidelines set forth by the Deutsche Röntgengesellschaft, DRG, which of the following actions represents the most appropriate and compliant response to address these findings? Option A. Conduct a comprehensive review of all CT protocols, ensuring they align with current DRG recommendations and best practices, followed by targeted retraining of all personnel involved in CT acquisition and interpretation. Option B. Focus exclusively on implementing the lowest possible radiation dose settings for all CT examinations, irrespective of the specific protocol or diagnostic requirements. Option C. Immediately implement a department-wide mandate to reduce CT scan acquisition times by 20% to improve patient throughput and reduce perceived workflow inefficiencies. Option D. Acknowledge the review findings but maintain current operational procedures, assuming that the deviations are minor and do not significantly impact patient care. The correct answer is A. Conduct a comprehensive review of all CT protocols, ensuring they align with current DRG recommendations and best practices, followed by targeted retraining of all personnel involved in CT acquisition and interpretation. Explanation. Scenario analysis. This scenario presents a professional challenge in ensuring the quality and safety of computed tomography, CT, examinations within a German radiological practice. The challenge lies in balancing the need for efficient patient throughput with the absolute requirement for adherence to established diagnostic protocols and radiation protection principles, as mandated by German radiology regulations. A governance review highlighting deviations necessitates a proactive and compliant response to maintain high standards of patient care and regulatory adherence. Correct approach analysis. The correct approach involves a systematic review and retraining process focused on the specific CT protocols and interpretation guidelines relevant to the Deutsche Röntgengesellschaft, DRG framework. This directly addresses the governance review's findings by ensuring that all personnel involved in CT examinations are up to date with current best practices and regulatory requirements. This approach prioritizes patient safety through accurate diagnosis and optimal radiation dose management, aligning with the DRG's commitment to quality in radiology. It fosters a culture of continuous improvement and regulatory compliance, which is paramount in medical imaging. Incorrect approaches analysis. Implementing a blanket reduction in CT scan times without a protocol review is a significant regulatory and ethical failure. This approach prioritizes speed over diagnostic accuracy and patient safety, potentially leading to misdiagnoses or the need for repeat scans, thereby increasing overall radiation exposure. It disregards the established DRG guidelines for specific examinations, which dictate appropriate scan parameters for diagnostic yield. Focusing solely on radiation dose reduction without considering protocol adherence is also problematic. A radiation protection is a critical component of CT. Reducing dose indiscriminately can compromise image quality and diagnostic interpretability, again risking missed findings or the need for rescans. The DRG emphasizes a balance between dose and image quality, achieved through optimized protocols. Ignoring the governance review findings and continuing current practices represents a direct failure to comply with internal quality assurance mechanisms and potentially external regulatory oversight. This passive approach undermines patient safety, diagnostic integrity, and the professional standards expected within German radiology. It indicates a lack of commitment to continuous improvement and adherence to the DRG's quality mandates. Professional reasoning. Professionals facing such a governance review should adopt a structured, evidence-based approach. First, thoroughly understand the specific findings of the review and their implications. Second, consult the relevant DRG guidelines and current literature pertaining to the identified CT protocols and interpretation challenges. Third, Develop a targeted action plan that may include protocol optimization, equipment calibration checks, and comprehensive retraining for staff. Fourth, implement the plan with clear objectives and timelines, followed by re-evaluation to ensure effectiveness and sustained compliance. This process ensures that all actions are grounded in regulatory requirements and best professional practice, prioritizing patient well-being and diagnostic excellence. Question 13. Governance review demonstrates that a radiology department has been operating with its radiation safety protocols largely unchanged for the past 5 years. While no significant incidents have been reported, the review highlights a need to ensure these protocols remain fully compliant with current best practices and regulatory requirements. Which of the following actions is the most appropriate response to this finding? Option A. Conduct a thorough review of all existing radiation safety protocols, comparing them against the latest guidelines from the Deutsche Röntgengesellschaft, DRG, and relevant German radiation protection legislation, Strahlenschutzverordnung SDRL-V, and implement any necessary updates. Option B. Prioritize expediting patient throughput by streamlining existing safety checks, trusting that the established procedures are efficient enough to maintain an acceptable level of safety. Option C. Assume that the absence of reported incidents signifies the adequacy of current protocols and maintain the status quo, with a note to revisit the protocols if any issues arise in the future. Option D. Delegate the task of reviewing and updating the safety protocols to the most junior radiographer in the department, with minimal direct supervision from senior staff. Correct answer is A. Conduct a thorough review of all existing radiation safety protocols, comparing them against the latest guidelines from the Deutsche Röntgengesellschaft, DRG, and relevant German radiation protection legislation, Strahlenschutzverordnung SDRL-V, and implement any necessary updates. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the immediate need for diagnostic imaging with the paramount responsibility of ensuring patient and healthcare worker safety in the context of radiation exposure. The challenge lies in implementing effective safety protocols that are both practical for daily operations and compliant with the stringent requirements set by the Deutsche Röntgengesellschaft, DRG. Misjudging the adequacy of existing protocols can lead to suboptimal patient care, increased radiation risks, and potential regulatory noncompliance. Correct approach analysis. The correct approach, which involves a comprehensive review of existing safety protocols against current DRG guidelines and relevant German radiation protection legislation, Strahlenschutzverordnung SDRL-V, represents best professional practice. This approach is grounded in the DRG's commitment to high standards of radiological practice and patient safety. It ensures that all safety measures, from equipment calibration and shielding to personnel training and dose monitoring, are up to date and aligned with the latest scientific understanding and regulatory mandates. This proactive and evidence-based review is essential for maintaining a safe environment and fulfilling ethical obligations. Incorrect approaches analysis. One incorrect approach would be to rely solely on historical practice and anecdotal evidence of safety without a formal, documented review against current DRG standards. This fails to acknowledge that radiation protection knowledge and best practices evolve. It risks perpetuating outdated or insufficient safety measures, leading to potential underprotection of patients and staff, which is a direct contravention of the SDRL-V and DRG recommendations. Another incorrect approach would be to prioritize speed of service over rigorous safety checks, assuming that standard operating procedures are inherently sufficient. This is ethically and regulatorily unacceptable. The DRG framework emphasizes that safety is not a secondary consideration, but an integral part of every radiological procedure. Neglecting thorough safety protocol verification can lead to accidental overexposure, a serious breach of patient rights and worker safety regulations. A third incorrect approach would be to delegate the entire safety protocol review to junior staff without adequate oversight or specific training in radiation safety regulations, as defined by the DRG and German law. This abdication of responsibility by senior leadership is a significant failure. It not only risks overlooking critical safety aspects, but also demonstrates a lack of commitment to the fundamental principles of radiation protection, potentially leading to systemic safety deficiencies and regulatory penalties. Professional reasoning. Professionals in radiology must adopt a systematic and evidence-based approach to safety. This involves 1. Staying current with DRG guidelines and relevant national legislation, SDRLSV. 2. Implementing a regular documented review cycle for all safety protocols. 3. Ensuring all personnel receive appropriate and ongoing training in radiation protection. 4. Fostering a culture of safety where concerns can be raised and addressed without fear of reprisal. 5. Utilizing a risk-based approach to identify and mitigate potential hazards. This structured decision-making process ensures continuous improvement in patient and healthcare worker safety, aligning with the highest professional and regulatory standards. Question 14. Quality control measures reveal a consistent decrease in the signal-to-noise ratio, SNR, for digital radiography images, while the X-ray generator's output, kVp, MA, exposure time, has remained stable. Considering the basic principles of radiation physics and the operational characteristics of a digital detector, which of the following represents the most probable cause and the appropriate initial diagnostic step? Option A. An increase in scatter radiation reaching the detector, obscuring the primary signal. Option B. A degradation in the X-ray tube's filament, leading to a less stable or lower intensity X-ray beam. Option C. A potential issue with the detector's sensitivity to X-ray photons or its signal processing electronics, requiring an evaluation of the detector's performance characteristics. Option D. A calibration error in the X-ray generator's output settings, despite the reported stable parameters. The correct answer is C. A potential issue with the detector's sensitivity to X-ray photons or its signal processing electronics, requiring an evaluation of the detector's performance characteristics. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a radiographer to interpret and act upon quality control, QC data that deviates from expected parameters. The challenge lies in understanding the fundamental physics of radiation production and interaction to correctly diagnose the cause of the deviation and implement appropriate corrective actions, all while adhering to the stringent standards set by the Deutsche Röntgengesellschaft, DRG. Misinterpreting the data could lead to suboptimal image quality, increased patient radiation dose, or unnecessary equipment downtime, all of which are critical concerns in diagnostic radiology. Correct approach analysis. The correct approach involves recognizing that a consistent decrease in the signal-to-noise ratio, SNR, in digital radiography, when other parameters remain stable, points towards a potential issue with the detector's sensitivity or its ability to accurately capture the incident X-ray photons. Specifically, a reduced SNR suggests that the signal, useful image information, is diminishing relative to the noise, random fluctuations. In the context of basic radiation physics, this could be due to factors affecting the conversion of X-rays to light or charge within the detector, or issues with the electronic readout system. A radiographer trained under DRG guidelines would understand that maintaining optimal detector performance is paramount for diagnostic accuracy and dose optimization, aligning with the DRG's emphasis on quality assurance and patient safety. This approach prioritizes a systematic investigation rooted in the physical principles of image formation. Incorrect approach is analysis. An incorrect approach would be to immediately assume a problem with the X-ray tube's output or beam quality without further investigation. While these factors influence image quality, a consistent decrease in SNR, with stable kVp, MA, and exposure time, is less likely to be solely attributable to the X-ray tube itself. The DRG regulations emphasize a methodical approach to troubleshooting, requiring the identification of the most probable cause based on the observed symptoms. Attributing the issue to the X-ray tube without considering detector-specific factors represents a failure to apply fundamental radiation physics principles to the diagnostic process. Another incorrect approach would be to simply increase the exposure factors, kVp or MA, to compensate for the perceived decrease in signal. This is a dangerous shortcut that ignores the underlying problem. Increasing exposure without addressing the root cause of the SNR reduction would lead to an unnecessary increase in patient radiation dose, a direct contravention of the ALARA, as low as reasonably achievable, principle, which is a cornerstone of radiological practice and heavily emphasized by the DRG. This approach demonstrates a lack of understanding of how detector performance impacts image quality and dose. A third incorrect approach would be to dismiss the QC findings as insignificant or within an acceptable tolerance without proper validation. The DRG mandates rigorous QC protocol to ensure the consistent performance of imaging equipment. Ignoring deviations, even if seemingly minor, can lead to a gradual degradation of image quality and potentially mask more serious underlying issues. This approach fails to uphold the professional responsibility to maintain equipment integrity and diagnostic accuracy. Professional reasoning. Professionals in diagnostic radiology must adopt a systematic and evidence-based approach to troubleshooting. When QC measures reveal deviations, the first step is to analyze the specific parameter that has changed and consider the fundamental physical principles governing the imaging process. This involves understanding how X-rays interact with the patient and the detector, and how the detector converts these interactions into a digital signal. Professionals should then consider the most likely causes of the observed deviation, prioritizing those that are directly related to the affected parameter. This analytical process, guided by the DRG's regulatory framework, ensures that corrective actions are targeted, effective, and minimize risks to patients and staff. If the initial analysis does not yield a clear cause, further investigation, potentially involving specialized service personnel, is warranted. Question 15. Process analysis reveals that a new radiographic imaging protocol has been developed with the potential to enhance diagnostic accuracy for a specific pathology. However, its integration into routine clinical practice requires careful consideration to ensure it aligns with established quality control and assurance standards. What is the most appropriate course of action to ensure the protocol's successful and safe implementation according to German radiological guidelines? Option A. Initiate a pilot study to evaluate the protocol's image quality, diagnostic performance, and radiation dose parameters on a representative patient cohort, followed by comprehensive staff training and the establishment of ongoing quality control measures before full departmental adoption. Option B. Immediately implement the new protocol across all relevant imaging modalities to leverage its potential diagnostic benefits as quickly as possible. Option C. Prioritize the perceived diagnostic advantages of the new protocol and proceed with its implementation, deferring any assessment of radiation dose or image quality verification to a later, unspecified date. Option D. Rely solely on the vendor's documentation and claims regarding the protocol's efficacy and safety without conducting independent internal validation. The correct answer is A. Initiate a pilot study to evaluate the protocol's image quality, diagnostic performance, and radiation dose parameters on a representative patient cohort, followed by comprehensive staff training and the establishment of ongoing quality control measures before full departmental adoption. Explanation. Scenario analysis. This scenario presents a common challenge in diagnostic imaging departments, maintaining consistent image quality and patient safety while managing workflow pressures. The introduction of a new imaging protocol, intended to improve diagnostic yield, necessitates rigorous quality control to ensure it meets established standards and does not inadvertently increase radiation exposure or compromise diagnostic accuracy. The professional challenge lies in balancing the adoption of potentially beneficial advancements with the imperative to uphold established quality assurance principles, as mandated by German radiological regulations. This requires a systematic approach to validation and ongoing monitoring. Correct approach analysis. The correct approach involves a multifaceted strategy that aligns with the principles of quality assurance and radiation protection as outlined by the Deutsche Röntgengesellschaft, DRG, and relevant German legislation, e.g. Strahlenschutzverordnung STRL-SchV. This approach prioritizes a structured validation process before full implementation. It includes a pilot phase to assess the new protocol's performance on a representative patient sample, comparing image quality and diagnostic findings against established benchmarks. Crucially, it mandates a review of radiation dose parameters to ensure they remain within acceptable limits and are justified by the diagnostic benefit. Furthermore, it emphasizes the need for comprehensive training of all relevant personnel on the new protocol and the establishment of clear quality control procedures for ongoing monitoring. This systematic validation and integration process ensures that the new protocol enhances diagnostic capabilities without compromising patient safety or image integrity, thereby fulfilling the DRG's commitment to high-quality radiological practice. Incorrect approaches analysis. Implementing the new protocol immediately without a pilot study or validation phase represents a significant regulatory and ethical failure. It bypasses the essential step of verifying the protocol's efficacy and safety, potentially leading to suboptimal diagnostic images or unnecessary radiation exposure, which contravenes the principles of radiation protection and quality assurance. Adopting the new protocol based solely on vendor claims without independent verification or internal quality assessment is another critical failure. This approach neglects the responsibility of the radiology department to critically evaluate new technologies and protocols to ensure they meet the specific needs and standards of the institution and its patients, as expected by the DRG. Focusing exclusively on the perceived diagnostic benefits of the new protocol, while neglecting to assess or monitor radiation dose levels, is a direct violation of radiation protection regulations. The principle of justification and optimization, ALARA as low as reasonably achievable, is paramount in German radiation protection law, and any new protocol must demonstrate that its diagnostic benefits outweigh the radiation risks. Professional reasoning. Professionals in diagnostic imaging must adopt a systematic and evidence-based approach to the implementation of new protocols. This involves 1. Understanding the regulatory landscape. Familiarize oneself with the guidelines and legal requirements set forth by the Deutsche Röntgengesellschaft and relevant German authorities regarding quality control, radiation protection, and patient safety. 2. Conducting thorough validation. Before widespread adoption, rigorously test new protocols through pilot studies, comparing outcomes against established standards for image quality, diagnostic accuracy, and radiation dose. 3. Prioritizing patient safety. Always ensure that radiation doses are optimized and justified, adhering to the ALARA principle. 4. Ensuring comprehensive training. Provide adequate training to all staff involved in the protocol's execution and interpretation. 5. Establishing ongoing monitoring. Implement continuous quality control measures to ensure sustained performance and identify any deviations or issues promptly. 6. Documenting all processes. Maintain detailed records of validation, implementation, training, and quality control activities for accountability and future reference. Question 16. The assessment process reveals a chest X-ray showing a well-defined, solitary pulmonary nodule in the right upper lobe. The patient is a 65-year-old male with a history of smoking. Which of the following approaches best guides the differential diagnosis process in this scenario, adhering to the principles of diagnostic radiology as emphasized by the Deutsche Röntgengesellschaft? Option A. Immediately classifying the nodule as benign based on its well-defined margins and proceeding with routine follow-up. Option B. Focusing solely on the nodule's size and shape, and recommending a biopsy without considering other potential causes or clinical factors. Option C. Developing a differential diagnosis that includes malignant possibilities, e.g., primary lung carcinoma, metastases, and benign entities, e.g., granuloma, hamartoma, and then stratifying the risk based on imaging characteristics, clinical history, and potentially further investigations. Option D. Concluding that the nodule is likely an artifact and not reporting it, as solitary nodules are often insignificant. Correct answer is A. Immediately classifying the nodule as benign based on its well-defined margins and proceeding with routine follow-up. Explanation. The assessment process reveals a scenario where a radiologist must differentiate between multiple potential diagnoses based on imaging findings. This is professionally challenging because imaging findings can be subtle, overlap between different pathologies, and require a comprehensive understanding of anatomy, physiology, and disease processes. The German Radiological Society, Deutsche Röntgengesellschaft, emphasizes rigorous diagnostic accuracy and adherence to established guidelines to ensure patient safety and optimal treatment. The correct approach represents best professional practice because it involves a systematic and evidence-based methodology. This includes correlating imaging findings with clinical history, laboratory results, and prior imaging studies. It also necessitates considering the most probable diagnoses given the patient's demographics and presentation, and then systematically ruling them in or out. This aligns with the ethical obligation to provide competent and diligent care, as expected within the framework of German medical practice and professional standards. The Deutsche Röntgengesellschaft promotes continuous learning and the application of current scientific knowledge in diagnostic radiology. An incorrect approach that relies solely on a single, striking imaging feature without considering the broader clinical context is professionally unacceptable. This could lead to misdiagnosis, delayed or inappropriate treatment, and potential harm to the patient. Such an approach fails to meet the standard of care and could be seen as a breach of professional duty, potentially violating guidelines that mandate comprehensive diagnostic evaluation. Another incorrect approach might involve prematurely concluding a diagnosis based on limited information or personal bias, ignoring alternative possibilities. This demonstrates a lack of critical thinking and a failure to adhere to the principle of differential diagnosis, which is fundamental to accurate radiological interpretation. This can lead to diagnostic errors and negatively impact patient outcomes, contravening the principles of responsible medical practice. A further incorrect approach could be to dismiss findings that do not fit a preconceived diagnosis, even if they are significant. This selective interpretation of data undermines the integrity of the diagnostic process and can result in overlooking critical information, leading to diagnostic errors. This is contrary to the meticulous approach advocated by professional radiological societies. The professional decision-making process for similar situations should involve 1. Thoroughly reviewing all available imaging data, paying attention to subtle findings. 2. Critically evaluating the clinical information provided, including patient history, symptoms, and relevant laboratory data. 3. Generating a comprehensive list of differential diagnoses that could explain the observed findings. 4. Systematically assessing the likelihood of each diagnosis based on the imaging features and clinical context. 5. Consulting relevant literature or seeking a second opinion from colleagues when faced with diagnostic uncertainty. 6. Clearly documenting the diagnostic reasoning and the rationale for the final impression. Question 17. The audit findings indicate a pattern of incomplete reporting in radiology examinations, specifically concerning the detailed description of incidental findings and the rationale for follow-up recommendations. Considering the Deutsche Röntgengesellschaft, German Radiological Society, guidelines on reporting standards, which of the following actions best addresses these deficiencies to ensure compliance and enhance patient care? Option A. Issuing a general reminder to all radiologists about the importance of thorough reporting, without specific guidance on incidental findings or follow-up recommendations. Option B. Implementing a mandatory departmental review of all reports with incidental findings by a senior radiologist before finalization, ensuring adherence to DRG guidelines for documenting incidental findings and recommending appropriate follow-up. Option C. Updating the departmental reporting template to include a single checkbox for incidental findings noted, without requiring specific descriptive details or follow-up rationale. Option D. Focusing solely on the technical aspects of image acquisition and interpretation, assuming that reporting completeness will naturally improve with better technical skills. The correct answer is B. Implementing a mandatory departmental review of all reports with incidental findings by a senior radiologist before finalization, ensuring adherence to DRG guidelines for documenting incidental findings and recommending appropriate follow-up. Explanation. The audit findings indicate a recurring issue with the completeness and clarity of radiology reports submitted by a specific department. This scenario is professionally challenging because it directly impacts patient care, legal defensibility, and the reputation of the radiology practice. Inaccurate or incomplete documentation can lead to misdiagnosis, delayed treatment, and potential litigation. The German Radiological Society, DRG, emphasizes high standards for reporting to ensure consistent quality and patient safety. Therefore, addressing these audit findings requires a thorough understanding of the DRG's guidelines on reporting standards and documentation. The correct approach involves a systematic review of the identified reporting deficiencies against the established DRG guidelines for radiology reports. This includes verifying that all essential components, such as patient identification, clinical indication, examination technique, findings, comparison with prior studies, impression, and recommendations, are present and accurately described. Furthermore, it requires ensuring that the language used is precise, unambiguous, and adheres to accepted radiological terminology. This approach represents best professional practice because it directly aligns with the DRG's commitment to quality assurance and patient safety, as mandated by their regulatory framework. Adherence to these standards is crucial for maintaining professional integrity and ensuring that reports are interpretable by referring physicians, thereby facilitating optimal patient management. An incorrect approach would be to dismiss the audit findings as minor clerical errors without a thorough review. This fails to acknowledge the potential impact on patient care and legal implications. It also disregards the DRG's emphasis on comprehensive documentation as a cornerstone of diagnostic radiology. Another incorrect approach would be to implement a superficial fix, such as a generic checklist, without understanding the specific deficiencies highlighted by the audit and how they relate to the DRG's detailed reporting requirements. This superficial solution would not address the root cause of the problem and would likely lead to continued noncompliance. A further incorrect approach would be to blame individual radiologists without a structured process for feedback and improvement, which is counterproductive and does not foster a culture of continuous quality enhancement as promoted by professional bodies like the DRG. The professional decision-making process for similar situations should involve 1. Acknowledging and taking seriously all audit findings. 2. Consulting the relevant regulatory guidelines, in this case, DRG guidelines on reporting standards. 3. Conducting a detailed root cause analysis of the identified deficiencies. 4. Developing and implementing targeted corrective actions based on the analysis and guidelines. 5. Establishing a system for ongoing monitoring and reevaluation to ensure sustained compliance and improvement. Question 18. Strategic planning requires a radiologist to accurately identify and classify injuries in trauma patients, considering the Deutsche Röntgengesellschaft (DRG) guidelines for trauma imaging. Which of the following approaches best reflects the required professional standard for assessing and reporting trauma-related injuries? Option A. An initial focus on identifying major vascular injuries, deferring the detailed classification of other injuries until the patient's condition stabilizes. Option B. A rapid identification of the most obvious fractures, with a focus on reporting only the most visually apparent bone disruptions. Option C. A subjective assessment based on personal experience, prioritizing speed of reporting over strict adherence to standardized classification systems. Option D. A systematic review of all imaging modalities, comparing findings against established DRG trauma classification criteria to ensure comprehensive and accurate injury grading. The correct answer is D. A systematic review of all imaging modalities, comparing findings against established DRG trauma classification criteria to ensure comprehensive and accurate injury grading. Explanation. This scenario presents a professional challenge due to the critical nature of trauma imaging and the immediate need for accurate injury identification and classification. The radiologist must not only recognize potential injuries, but also categorize them according to established trauma grading systems, which directly impacts patient management and prognosis. The urgency of trauma cases, often involving multiple injuries and potential for rapid deterioration, demands a systematic and precise approach, adhering strictly to the guidelines set forth by the Deutsche Röntgengesellschaft, DRG. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based evaluation of the imaging findings against established DRG guidelines for trauma classification. This ensures consistency, accuracy, and facilitates effective communication with the trauma team. Adherence to these guidelines is ethically mandated to provide the highest standard of care and legally required to meet professional obligations. An incorrect approach that focuses solely on identifying obvious fractures without considering associated soft tissue injuries or internal organ damage fails to meet the comprehensive requirements of trauma imaging as outlined by the DRG. This oversight can lead to underestimation of injury severity and delayed or inappropriate treatment, violating the ethical duty to provide complete and accurate diagnostic information. Another incorrect approach that relies on subjective interpretation or personal experience without referencing standardized DRG classification criteria introduces variability and potential bias. This deviates from the DRG's emphasis on objective, reproducible assessment, potentially leading to miscommunication and suboptimal patient care, which is an ethical and professional failing. A further incorrect approach that prioritizes speed over thoroughness, leading to the omission of critical imaging sequences or views necessary for complete injury assessment, directly contravenes DRG protocols for trauma imaging. This haste can result in misdiagnoses, posing a significant risk to the patient and representing a failure to uphold professional standards. The professional decision-making process in such situations should involve a systematic review of all imaging modalities, cross-referencing findings with the patient's clinical presentation, and applying the relevant DRG trauma classification guidelines rigorously. This structured approach ensures that all potential injuries are identified, accurately classified, and communicated effectively to the multidisciplinary trauma team, thereby optimizing patient outcomes and adhering to professional and ethical obligations. Question 19. Stakeholder feedback indicates a need for enhanced clarity on differentiating common anatomical variations from potential pathologies in routine radiological examinations. A radiologist reviews a CT scan of the abdomen and pelvis of a patient presenting with nonspecific abdominal discomfort. The scan reveals a prominent, lobulated structure in the retroperitoneum, adjacent to the aorta, which appears to have a density similar to surrounding soft tissues, but lacks clear vascularity or enhancement after contrast administration. The radiologist is aware of several common anatomical variations in this region that can present as discrete masses. What is the most appropriate course of action for the radiologist in this situation, adhering to the standards of the Deutsche Röntgengesellschaft? Option A. Recommend immediate biopsy of the retroperitoneal structure to definitively rule out malignancy, given its discrete nature. Option B. Advise the referring physician to schedule an MRI of the abdomen and pelvis for further characterization, as CT is insufficient to differentiate between a variation and a pathology. Option C. Carefully compare the imaging characteristics of the retroperitoneal structure with known anatomical variations of the retroperitoneum. Consult relevant DRG guidelines and literature, and if consistent with a benign variation, report it as such, noting its benign nature. Option D. Conclude that the finding represents a common benign anatomical variation, document it as such, and proceed with reporting the rest of the scan without further comment. The correct answer is A. Recommend immediate biopsy of the retroperitoneal structure to definitively rule out malignancy, given its discrete nature. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the radiologist to differentiate between a true pathological finding and a common anatomical variation. Misinterpreting a variation as pathology can lead to unnecessary patient anxiety, further investigation, and potentially inappropriate treatment. Conversely, missing a subtle pathological finding due to over-reliance on recognizing variations can have serious consequences for patient care. The challenge lies in the nuanced interpretation of imaging findings within the context of established anatomical knowledge and the specific clinical presentation, all while adhering to the standards set by the Deutsche Röntgengesellschaft, DRG. Correct approach analysis. The correct approach involves a systematic evaluation of the imaging findings, cross-referencing them with known normal anatomical variations as documented in DRG guidelines and relevant radiological literature. This approach prioritizes patient safety and efficient healthcare resource utilization. By recognizing the variation and understanding its benign nature, the radiologist can confidently exclude pathology, thereby avoiding unnecessary patient distress and further diagnostic procedures. This aligns with the DRG's emphasis on accurate diagnosis and responsible medical practice, ensuring that diagnostic imaging serves its intended purpose without causing iatrogenic harm or undue burden. Incorrect approach is analysis. One incorrect approach would be to immediately flag the finding as suspicious and recommend further invasive investigations without thoroughly considering common anatomical variations. This fails to meet the DRG's standard for diagnostic accuracy and responsible interpretation, potentially leading to unnecessary patient harm and resource expenditure. Ethically, it breaches the principle of non-maleficence by exposing the patient to risks associated with further procedures without sufficient justification. Another incorrect approach would be to dismiss the finding entirely without careful consideration, assuming it is a variation without proper verification. This could lead to a misdiagnosis of a genuine pathology, which is a direct contravention of the radiologist's duty of care and the DRG's mandate for thorough diagnostic evaluation. This failure to identify pathology has severe ethical implications, violating the principle of beneficence and potentially causing significant harm to the patient. A third incorrect approach might involve relying solely on automated software interpretation without critical human oversight, especially when encountering findings that could represent variations. While AI can be a valuable tool, the DRG emphasizes the indispensable role of the experienced radiologist in interpreting complex cases and differentiating subtle findings. Over-reliance on automation without expert validation can lead to errors, as software may not always accurately distinguish between normal variations and early pathological changes. Professional reasoning. Professionals should adopt a structured approach. First, meticulously review the imaging for any abnormalities. Second, consider the patient's clinical history and symptoms. Third, consult established radiological atlases and DRG guidelines for known anatomical variations that could mimic pathology in the observed region. Fourth, if a finding is consistent with a known benign variation, document this clearly and explain its benign nature. If there is any doubt, or if the finding deviates from typical variations, recommend further appropriate investigations or consultation. This systematic process ensures that diagnostic decisions are evidence-based, patient-centered, and compliant with professional standards. Question 20. Quality control measures reveal a consistent trend of slightly lower success rates and a marginally higher incidence of minor complications in a specific interventional radiology procedure when compared to alternative techniques for similar indications. The interventional radiology team is considering adopting a newer, more technically demanding technique that promises potentially better long-term outcomes, but lacks extensive long-term data and has a steeper learning curve. Which approach best aligns with the principles and guidelines of the Deutsche Röntgengesellschaft, DRG, for interventional radiology? Option A. Prioritize the adoption of the newer technique based on its perceived technological advancement and potential for future innovation, irrespective of current comparative outcome data. Option B. Immediately adopt the newer, more technically demanding technique to gain experience and potentially offer superior long-term results, assuming the initial learning curve is manageable. Option C. Continue utilizing the established technique while actively participating in research to improve its outcomes and closely monitoring the performance of the newer technique in controlled studies. Option D. Maintain the current practice without further investigation, attributing the observed trends to inherent patient variability and the complexity of the procedures. The correct answer is C. Continue utilizing the established technique while actively participating in research to improve its outcomes and closely monitoring the performance of the newer technique in controlled studies. Explanation. This scenario is professionally challenging because it requires a radiologist to critically evaluate the efficacy and safety of different interventional radiology techniques in the context of specific patient conditions, while adhering strictly to the guidelines and standards set by the Deutsche Röntgengesellschaft, DRG. The choice of technique directly impacts patient outcomes, procedural success rates, and potential complications, necessitating a deep understanding of each method's strengths and limitations. Furthermore, the DRG's framework emphasizes evidence-based practice and continuous quality improvement, demanding that decisions are not only clinically sound, but also align with established professional norms and regulatory expectations. The correct approach represents best professional practice because it prioritizes patient safety and optimal clinical outcomes by selecting the interventional technique that is most appropriate for the specific clinical indication and patient profile, as supported by current evidence and DRG recommendations. This involves a thorough assessment of the risks and benefits of each available method, considering factors such as the patient's anatomy, comorbidities, and the specific pathology being treated. Adherence to DRG guidelines ensures that the chosen technique is performed with the highest standards of care, minimizing complications and maximizing therapeutic success, thereby upholding the profession's commitment to patient well-being and responsible practice. An incorrect approach that focuses solely on the perceived novelty or technical complexity of a procedure, without a clear clinical advantage, fails to meet professional standards. This is a regulatory and ethical failure because it deviates from the DRG's emphasis on evidence-based medicine and patient-centered care. Such a choice could lead to unnecessary risks for the patient, increased costs, and potentially suboptimal outcomes, violating the principle of primum non nocere. First, do no harm. Another incorrect approach that relies on anecdotal experience or personal preference over established protocols and evidence is also a significant regulatory and ethical failure. The DRG framework mandates that clinical decisions are grounded in scientific evidence and validated techniques. Ignoring this principle can result in the application of outdated or less effective methods, compromising patient care and potentially leading to adverse events. This demonstrates a lack of commitment to continuous professional development and adherence to the established quality standards within German radiology. The professional decision-making process for similar situations should involve a systematic evaluation of the clinical problem, a comprehensive review of the available interventional radiology techniques, and a critical assessment of the supporting evidence for each. This includes consulting relevant DRG guidelines, peer-reviewed literature, and, when necessary, seeking expert consultation. The decision should be a collaborative one, involving the interventional radiologist, referring physician, and the patient, ensuring informed consent and shared decision-making. The chosen technique must be justified by its potential to achieve the best possible outcome for the individual patient, with a clear understanding and mitigation of associated risks.